Hi everybody. Today I have 6 tips for you on how to stop touching your eyes. This is part of a video series about how to stop touching your face. And I broke it down into mouth, nose, eyes, and then the face in general. In this COVID world that we live in, the most important thing you can do to prevent yourself from getting sick is to wear a face covering out in public. This is closely followed by washing your hands a lot and then stop touching your face. What we don't want to do is go touch dirty things and then bring that dirt and bacteria and viruses up to our face, and that will get us sick. Face touching is mostly unconscious, which means we don't really realize that we're doing it. So I'm here to help you today figure out how to stop touching your eyes. So please stay tuned. I'm Dr. Rachel Johns, an internal medicine doctor specializing in hospital medicine in Southern California. My passion is educating patients on healthcare topics that matter so that you can live your best life. We're talking a lot about COVID-19 these days. It's all around us, and there's a lot of misinformation out there. So I'm here to bring you the latest and most up-to-date, accurate information, bring you the latest on scientific research, and we'll dispel some myths. So please subscribe to my channel so you don't miss any of this important information. So as I said before, face touching is mostly unconscious. In the first video, we talk about the motivation to change a bad habit and how to become conscious of something that is an unconscious habit. So I'm going to refer you to that video because if you're watching the whole series, I don't want it to be too redundant. The eyes are really important and under-recognized method of transmitting disease. For one, it's a mucous membrane, which means that viruses can get right in there, right through your eyes. COVID is a respiratory virus, but your eyes are actually very important. And if someone coughs or sneezes on you, and that mist gets to your eyes, the virus can go right in there. And the other way is actually through your tear ducts. Do you ever notice that when you cry, your nose gets watery? And the reason is that your tear duct, which is about right there, actually drains right into your nose, goes back down the back of your throat, and then you can breathe it in from there. So 2 ways that the virus gets into your body through your eyes. So one thing what we can do is actually cover our eyes, wear some glasses when you go outside in addition to your face covering, but also let's stop touching our eyes. So how do we do that? Again, I have 6 tips for you today. The first 2 tips are the same 2 as in the first video, how to stop touching your mouth. And the thing is that we need to change the way that we sit or stand. If we're at a desk or we're standing behind a counter, we have a surface in front of us. Often an elbow will come up, and then the next thing you know, your face is sitting in your hand, and then your hand is all over your face. So let's put our hands together and put them down in your lap, or if you're standing, you can put them behind your back. If your hands are holding each other, then they can't touch your face. The second tip is just to keep those hands busy with something else. Maybe it's time to bring back those fidget spinners. We can bring a stress ball, or some people like to wear a bead bracelet that they can then rub the beads. Anything you want to do to keep your hands busy and off your face is fine. Tip number 3, if you wear glasses, make sure they fit you well. If you look down and the glasses slide down your nose, then they don't fit right. What happens when they slide down your nose is that you're taking your finger, usually your index finger, and you push it up from the bridge. You're not getting your finger right into your eye, but it's too close for comfort. If you do need to adjust your glasses, please grab them by the sides and then adjust them from there. Tip number 4 is for contact lens wearers. Now, obviously, you're going to be touching your eyes twice a day when you're taking them out or putting them in the morning, but there's a new study that came out in April that actually had to do with how many times contact lens wearers touch their eyes, not those times, but other times during the day. And what they found was that people touch their eyes a lot when they wear contact lenses. most commonly because they're not following the right hygiene for contact lenses. And so when they put them in, their eyes become inflamed and then they're rubbing their eyes. So how do we do correct contact lens hygiene? You need to wash those contact lenses every day. Wash the case every day. Don't just put saline on top of the saline that's already in there. That's like stagnant water at the edge of a pond that gets the pond scum in there. You don't want that in your eyeballs. So clean your contact lens, clean the case, and replace the case at least every 1, 2, 3 months. That's very important. This might be difficult for some of the women out there, some of the men too, but now is not the time for fake eyelashes or eyelash extensions. The glue that you use to keep them on can be itchy, and then that will lead to eye rubbing as well. So I know they look great, but now is just not the time for that. The last tip I have for you is, it's inevitable to get dust or dirt in our eyes at some point, and then we're rubbing our eyes trying to get that out. So it would be a good idea to get either a handkerchief or keep some tissues around so that if you do need to rub some dirt or dust out of your eyes, you're not doing it with your bare hands. Get a tissue or a handkerchief and then use that to rub your eyes. So those are the 6 tips I have for you today. I would love to know what tips and tricks worked for you. Please leave that in the comment section below. If these did not work for you, I'd like to know that too. I'm Dr. Rachel Johns, and I'm here to help you control your medical problems so that they don't control you. Bye.